So what's your story? A couple of other Pennsylvania caregivers would also like to share their stories of experiences with their children and emergency preparedness.
Okay, so I am a single mom. I have 2 young boys. My oldest, who is 15, is a special needs child. He threatened to commit suicide in March of 2021. We were recommended to go to the emergency room. So I took him to our local hospital, where he was not admitted. He was in a bed for the day in the emergency room. It began with a triage of some very nice professional nurses. And then we had some professionals come in throughout the day. They were very kind, very compassionate. My son was severely depressed. He does not communicate with most people, especially individuals that he doesn't know. The individuals that we worked with were especially caring and tried to reach out to him and show him compassion, which really helped him to open up and to talk a little bit about what he was feeling. And he had a very strong desire to not go anywhere, associate with anyone. He did not want to even communicate with friends. He was isolating. And so it was very difficult. He did not want to communicate with myself and his father. And so we had a very difficult time trying to understand what was happening since he wasn't communicating with us. The individuals that came into the emergency room, and there was nurses, there was doctors, there was emergency personnel. He was in a safe room, and they were very professional, but yet very kind and compassionate, and really tried to bond with him so that he opened up to them. That was just the most important aspect. They remained calm. Of course, there was no accusations. They simply tried to connect with him and get him to communicate his needs to them. So we were there for a 12-hour period. It was a nurse came in and brought an actual telemedicine video in, and a psychiatrist was live and did an evaluation. So he had, at the end of the day, appeared as if those issues were resolved, which made for a difficult diagnosis and follow-up care. So the most important thing would be to ask open-ended questions and to bond, to try to get him to communicate, especially with my son. He just does not trust any outside individuals that we have not had any communication with. My son is non-violent, non-aggressive, just very isolating, and does not like to communicate. And so it's been a very difficult struggle because of that initial evaluation with emergency and hospital personnel. It's made it extraordinarily difficult for us to find the assistance that we need because of that initial evaluation. So it just being aware of a child's ability or non-ability to communicate well, and taking into an account the parent's perspective. Many parents do have, and some parents don't react well in those situations. I have an emergency response background myself, so I have some knowledge and ability, but many parents don't have that or the knowledge, and so their response may look different, but just knowing that, communicating with the parents as well to confirm the best way to communicate, but being compassionate and caring is one of the easiest ways to gain an understanding of what's going on.
Hi, I'm a parent of a child of an 18-year-old who has some special needs and just completed a surgery, and we were at home. I think due to all of the medications from the surgery, it caused inflammation, and we noticed our daughter started reacting to her pain in a different way. She started experiencing some pain after the surgery and started screaming that the pain was that intense. We called 911. We explained the situation and that we needed someone to come to the house because we couldn't move her. She had a leg surgery, and her leg was completely not in a cast or anything, but in a brace, and we could not move her. We needed some assistance to do so. They came into the home, and we brought something to carry her down in. And the surgery had just happened 2 days before. She was screaming in her room, and as soon as she saw the EMT come into her room, the police officer come into her room, maybe someone from fire department came into her room, that really scared her, to have all of these people into her room like that, all staring at her. She was crying hysterically, screaming, and they ended up transporting her using a collapsible device. And after the surgery and her moving it in that position to get her down the stairs and into the ambulance just caused even greater stress. I think they didn't touch her for a while because they weren't sure if she was going to hurt them, or maybe they just weren't sure. They needed to assess the situation better. But she was kind of left before they actually took her out, probably left in the room screaming and crying, maybe 10 minutes, 15 minutes before they actually tried to move her. And I think if she had been moved earlier, that stress would have been a lot less painful for her.
Fantastic. So we appreciate hearing the different perspectives from the family members. And now we'd like to hear from some first responder stories.
So our first responder is Lieutenant Brian Foch. And Brian is a lieutenant with the Horsham Fire Company in Montgomery County, where he's been an active first responder for over 30 years and is a certified paramedic and firefighter. Brian is the father of 3 children, one of which is diagnosed with autism. And having an autistic child has led Brian to share his stories with other first responders and train them to be better prepared in care for this particular population.
Good morning. My name's Brian Foch. I'm a lieutenant with the Horsham Fire Company. Recently, I responded to a behavioral psych emergency involving a 14-year-old male. In reading through the notes, it was advised that it was a 14-year-old male with autism that was acting out and was extremely violent. On arrival, we had multiple police officers on location. We spoke with the parents briefly, and they were kind of at wit's end. They didn't know what else to do with their son based on his behaviors. As we entered the house and went back to his room, the 14-year-old was in his room kind of acting out and just very agitated and upset. There was multiple police officers and multiple other responders on location. I kind of had everyone punt back, and I entered the room trying to get a bond with him. What I used was something called redirection. I looked around his room to find something that was alike for him and engaged a conversation with that. I was pretty successful. It took more time than a normal ambulance call would normally do, and that's one of the things I recognized based on having a son with autism. My experiences with my son growing up, and the wins and successes and the losses helped me to help this boy in need. About 14 years ago, I recognized the need for training for emergency responders, and I built upon that training based on my personal knowledge, research, and input from other parents with autistic children. It took about 45 minutes, but I was able to get the boy out to the ambulance without having to restrain him, without having to sedate him, and really had a good bond, which paid off the second time I picked him up, because in the middle of his duress, he was able to recognize me and kind of calmed himself and engage in conversation again about what I had redirected him the first time. Training pays off, and calm creates calm. That's my advice for someone dealing with someone with autism.
So one of the key takeaways I think we can see is from the first responder survey, I'm sorry, from the first responder story, is good communication, developing trust with the patient in this case, and forming that partnership between first responder and patient and caregiver always has a better outcome than not doing so. Kelly, how about the family stories? What do you want to offer?
You know, Dwayne, I'd have to echo the same thing, that trust is huge, a little bit of understanding, and then hearing what everyone has to say are fantastic to help us partner to do the work that we are there to do, to treat the individual.